At least when I was in university, concussion was taught as a coup contra coup injury. So when I was in my athletic injuries program, they would teach it that, what happens in a concussion is that the brain smashes up against the inside of the skull and then bounces back and hits the back part of the inside of the skull, and that's your coup contra coup injury. Now, some of the newer research coming out looking at some of the functional imaging techniques such as diffusion tensor have found that most of the dysfunction lies in the white matter, which is the deeper part of the brain. And the new theory is a stretch or shear theory. So the coup contra coup theory of the brain actually impacting the skull and bouncing back and impacting the back part of the skull is kind of been replaced for the most part with the stretch or shear theory. So if you picture an individual axon as almost an elastic band, that axon will have a porous membrane. So there's little holes within that axon to allow for ion exchange to occur. Now, when that brain cell gets stretched, when the injury happens in the brain, you can picture like a piece of jello. So if you were to shake a plate of jello, the brain's going to deform, or the jello's going to deform up this way and then come back and deform the other way. If you can picture each strand of brain tissue being almost like an individual fiber of jello, and the same thing occurs where the brain shakes and jiggles, and when it does, that brain cell gets stretched. Well, those little pores in the brain cell itself, in the neuron, become stretched and opened. So then you're going to get an ion exchange, and that's really what happens is there's an excitatory phase of concussion due to that initial ion exchange. Now, the question is actually, I just wanted to ask, does any contact occur between the brain and the skull? Does it play a role in concussion? Because this person is already aware that the new theory is the stretch and shear theory. So the deeper part of the brain is called the white matter. The outer part is called the gray matter. The new thought is that concussion is actually more of a white matter injury than it is a gray matter injury. Now, does the brain hit the inside part of the skull? Possibly. I think that there's definitely in more severe brain injuries, when you get into things like cerebral contusions, which is when the brain actually does hit the inside of the skull, and that actually does create bruising that can be seen potentially on imaging, where you get susceptibility weighted imaging where it can pick up these micro bleeds and this bruising in brain tissue. That does occur in the more severe trauma. In a concussion, does the brain impact the inside of the skull? I think it's highly, highly possible. And I think that the gray matter part could be involved in the symptomatology of that injury. However, the consensus now is that most of concussion pathophysiology is occurring at the deeper levels in the white matter.